All right, how are we looking today? We look good over here?
Yeah.
Is anybody watching this? Does anybody still watch this?
I think so.
Okay. Well, I know
so.
every once in a while I go back and just make sure that you can see us and that we're actually on there and you can hear us. How are things going, Dr. Bunio?
They're doing great.
Good.
It's good to see you. And now I know it's Wednesday because here we are.
Here we are. You've gone back to the flamingo mask.
I have. It's on my rotation.
Oh, I like it. I got to get me a rotating mask set.
Yeah.
I need one for each car. I've realized I take off in the other car and I'll end up somewhere where I need my mask, but it's in my first car. And I'm
That's
like,
a good
no.
idea. Yep.
I guess that's a first world problem to have two cars. But so we've got a lot of questions from the public today, and it's exciting to get back. I wanted to ask you a personal question, though, before we get too far into it. So, we're going to miss out on some professional sports this year. Do you have a favorite football team?
I do.
Well, who's your
actually.
favorite football team? You got to share this with the public here because that will dictate whether or not people actually listen to what we say or not.
Okay. Well, I'm ashamed to say I kind of follow the Cleveland Browns.
Cut.
And I don't know
It's
why.
off the air. No, the Cleveland Browns, that's cool. They've got a storied history, of course. I know there's a few fans out there still. They've had some up and downs. I'm a Dolphins fan, and so I don't have much to talk about myself other than that one undefeated season we're still rolling on 40 years later. So you got a lot of stuff happening at the hospital?
Yeah, we're working real hard. Fortunately, everybody's really pitching in, and we're doing real well.
Good.
So far, so good.
In the last week, we've seen a lot of things changing in town here. I know there's a lot more activity. Driving through today, I saw a lot more cars in the retail shops and such. So I know people are starting to move around and be more active.
Yep.
There was a couple of questions that came in ahead of time here. How many positive cases have recovered so far?
So far, we've had 16 positive cases, and of those, 15 have completed their quarantine and they've recovered. They're no longer considered contagious.
Okay, good.
And none of those cases required hospitalization.
And that's the big thing in this,
Yep.
right? We're trying to mitigate the hospital load, I guess, at
Yep.
this point. Now, another question came in. Is CIHA ever going to test or get the saliva tests? And can we talk a little bit about the saliva test? I'm not sure what that is.
Yeah, we looked at that early on. So we will get the saliva test if we think that it is valid and reliable.
Okay.
Right now, the jury's still out on that. So I did look at it. There's another health system, Advent Health, was using it early on, and I didn't feel like we had enough data on it. But the theory is if you, because the virus is in the back of your nose, if you cough a couple of times into your elbow and then we swab or get some of your saliva, the theory is we're going to pick up the virus there.
Okay, I got you.
But they're still testing it. And I'm sure you and your audience have heard that there's controversy even about the rapid test that,
Right.
Everybody thought was going to be our savior. Now, there's been some reports that it may give us too many false negatives.
Yeah, and the false negative simply means that you actually are positive, but the test itself didn't pick up enough of it to test it positive.
And out of the two, that's kind of the worst thing to happen because then we're going to say, hey, you're fine, and then you're going to go out there and spread the virus.
Right. So. Okay. Well, good. We'll go through the hotline number. Of course, we have here with us today. We have this beautiful new stand. What do you think? Our technology is just getting better and better each week.
This is a high-class operation.
That's what I'm talking about. Watch out, CNN. So, COVID-19 hotline, of course, 828-497-3743. If Ty's out there watching, I'm not going to hold that in front of my face today, just for you, buddy. All right, so what am I risking if I decide to travel during this time with my family? As I mentioned earlier, we're starting to see more travel now, and so folks are starting to feel like these lifts and these restrictions being kind of eased means that it's time to run and go travel and take a trip. What are we risking if we do decide to travel?
Well, the short answer, Chris, is that you're risking catching the virus and bringing it back to your family and this community.
Okay.
So we've all seen on the news people in the crowded beaches or going out to restaurants where they aren't following those restrictions. That's a risk, particularly if you're going to an area. Charlotte's got quite a lot of cases, the area around Raleigh. So when there's more virus activity, there's a greater risk that someone's going to be next to you who's maybe asymptomatic and doesn't even know that they have the virus, and they're going to cough or sneeze or just even talk, and the virus is going to be in the air. Or maybe it's on the table at the restaurant from the person before.
Right.
And remember, we've talked about how it can live on surfaces for up to 3 days.
That's
so,
correct.
yeah.
So my thought with it as well was, we're in some of these hot spot cities. The first reaction as travel bans ease and people start to move again is that folks in those cities are going to start to hit the beaches and start to get out of town thinking, I need to get away from this for a little bit,
Yeah.
carrying it to those spots, which makes it even more of a hot spot in and of itself.
Yeah, that is a risk. So we get it. People are gonna want to get out. There's people are getting cabin fever.
Right.
They're gonna want to travel for both for their family and for their own mental health. We understand that.
Right.
But there's high risk travel and low risk travel, and I think that we just need to be smart about what we're doing.
Well, with that in mind, what is I have family members that are recently returned from travel. What precautions should I take, and what should they do?
So that's a really good question. If you or one of your family members is traveling, I think you want to kind of look at these red flags. You know, did they go to somewhere where they were in a congregate area? And by that, I mean where there's a lot of people packed in together.
I'm glad you break down your big words.
Yeah. Sorry. I have to do that for myself.
It took me a minute. I kind of blinked. I'm not sure what that means.
So did they go to like a concert or, a rally or just something where there's a lot of people? That's a high risk activity.
Okay.
Did they take any form of public transportation? Did they fly on an airplane? Or were they on a bus? Were they in an enclosed space? So if your family member returned from travel, you want to kind of go through this. If they went in their own personal vehicle, if they were kind of in an area where they could practice social distancing, outdoor activities are ideal.
Yeah.
If you're, fishing or hunting, or if you're at a beach when there's not a lot of people around, that's low risk.
Right.
If they're doing that, then, I think when they return, they need to do the same things. But if they've traveled and done something that's high risk, well, you may want to have them self-isolate themselves for a little while.
Gotcha.
The standard is a 14-day period. That's the incubation period. If your family member went to a high-risk area and they might have brought that back, it's not a bad idea to have them isolate for 14 days to make sure they didn't bring it back to your house and to this community.
Okay, good deal.
Yeah.
What is a high-risk travel area?
Well, there you go. So we're no longer talking about a specific location as being high risk. So obviously New York City, everybody's heard of that. So now we are talking more, even up at the hospital, about we need to just define high risk activities. It's more important. It's not as important where you went, although that's important, but it's how you got there and what you did when you were there.
Okay.
So it's more high risk travel activities, or the whole travel package that we're going to look at when we're trying to decide.
Gotcha. So if someone returns asymptomatic, there's still a potential for them to spread. That's where the danger in this exists, right?
Yeah, and you can look at any one of these maps. North Carolina Department of Health and Services. You can look at every county and see how many cases they've had.
Okay.
And the two that really stand out are Mecklenburg County, where Charlotte is, and then in the Wake County.
So I think what's important for the public to know at this point is it's not the fact that you travel or get or in high risk areas. The thing is that when you get back, make sure you practice that social distance and wear your mask. Keep this from grandma and grandpa for a week or two, and just kind of make sure that you're good, because the risk is bringing it back asymptomatically, feeling fine. I went on vacation. Of course, you're gonna feel great, hopefully. But when you get back, make sure you take the precautions to not spread this out to the rest of your family or the community in case you picked it up. Yeah, just continue to practice the safe habits.
You've got it. And even if you're going and you're staying in a motel or a hotel room, take some sanitizer. Wipe down surfaces. Right. 3 days. That virus could live on that table. Hopefully the hotel is doing what they're supposed to do, and they're doing that cleaning for you. But it doesn't hurt to be extra careful.
Never assume that.
Yep.
I've seen some really crazy hotel rooms.
Yeah.
We won't talk about that on this episode. Okay, so I've seen pics from big families get-togethers all over Facebook, many of which are not wearing masks. If it's a large, close-knit family, is that okay? I mean, if we've got a lot of folks together like this?
It's risky. So, of course, if you want to get together with your family that you already live with, that's fine.
Right.
But if you got a large extended family that's coming from different parts of the boundary or from off the boundary, different communities, the risk there is one person in that gathering
Yeah.
could pass it to 20, 30 people, and then they go back and spread it everywhere. So there is risk associated with that. I think, last time we talked about that one choir member who passed it to like 52 different people.
Oh, wow.
Right. And they weren't wearing masks. They were in close proximity, singing, I guess, pretty vigorously.
Right.
And sometimes those droplets come out when you're hitting those high notes.
That's how I sing. I tend
Yeah.
to just belt it out there, and I'm sure if I had the virus, I've got to make sure I have my double mask. It doesn't sound as good when you're singing with your mask on, but certainly practice safe habits.
Maybe do that in the shower.
I wear my mask in the shower too now.
Yeah.
So if you're at home, again, if you're going to have a big family gathering, just try to practice safe habits as much as you can. Wash hands, wash surfaces, wear your mask, protect your elders that are there.
Yep.
What would you define social distancing as?
Well, the answer to that is 6 feet. That's sort of this magic number that we think if somebody around you is talking or coughing or sneezing, the majority of those virus droplets are going to fall to the ground within 6 feet. Now, there's a lot of other factors there, so 6 feet it's not 100%. If somebody's coughing and the wind is behind them, it's going to come right at you. So basically, you want to try to stay 6 feet away from everybody, and that's social distancing.
The Lion King taught me that you don't want to stand downwind of people anyway, in general.
Probably a good idea. I was thinking about people smoking. When you can smell smoke, you're too close.
You're too close.
Yeah.
Okay.
Which we don't recommend smoking.
With the economy reopening, what all can we do to combat this virus?
Well, it's the same stuff we've been talking about. First of all, don't go out unless you really need to. Wear your mask. Practice, social distancing, good hand hygiene. Don't touch your face. It's all the same stuff. Now, when the economy reopens, we hope that the stores and restaurants, if you're going to go, that they're taking those extra precautions. If you see that and you see that people are spread out and they're cleaning frequently, that should make you feel more comfortable.
Right.
So keep an eye out for that too.
Good deal. Ted, if you are practicing out in the economy, if you're going out, and we encourage folks to continue to do that if they can or if they want to, but if you do go out and you purchase something from a retailer, you still have to take on that personal responsibility. Make sure that you're washing your hands. Make sure that you're coming home and practicing safe. Imagine that you've come in contact with it and just practice that safe distancing, right?
Yeah, the virus is invisible. We don't know where it is, so you should just assume that everything that you're coming into contact with may have it.
Gotcha. Okay. The CDC has changed its guidelines multiple times during the outbreak. Why should I trust anything they're saying?
Well, they have changed their guidelines multiple times, and I think one of the reasons that we can trust them is they are willing to change their guidelines. I mean, this is a new virus, the novel coronavirus. We're just learning things as quickly as we possibly can. So I think it's a sign of an honest authority that they're willing to say, hey, what we said before, we were wrong. Now this is a better way to do it.
Right.
So I think the CDC is one of those authorities that you can trust what they're saying. But this is a frustrating time for everybody.
Yeah.
Everybody wants to know exactly what's the right answer to combat this virus. And if we knew that, that'd be great.
Yeah, we're running around in the dark with this for the most part, and so we have to be fluid in the fact that we're working with the information we have.
Yeah.
And the best information we have at this point are the things that we've been adapting and changing and saying, though, which is the social distancing. Wash your hands. Those are the things that are kind of just a given in general. Like, that's some truth, right? Wash your hands, practice some social distancing.
Yeah, I mean, that's good advice, 5 years ago. If you don't want to catch the flu, these are things that you should be doing. The stakes weren't quite as high before.
Right.
So, yeah, I understand that this is frustrating for people. It's frustrating for us in the medical field as well. We'd love to be able to tell you, just do this and you'll be fine. But we have to be honest with people.
Right.
And I think the CDC does too.
Good. Well, that's good. So what's the benefit of testing if I test negative today and then I get exposed tomorrow and potentially positive after the negative results? Does that make sense?
It does. I think this goes to, why should I get tested today if there's going to be a need for me to be tested tomorrow or the next day or the
Right.
next day after that? Well, there's a couple of different reasons why we want you to be tested, and one is you're sick, and we want to find out if you're sick because of the virus.
Okay.
You should be tested for that. But then there's also this sort of surveillance testing that we've been doing where people have really been really good about coming in, even though they don't feel sick. They just
Right.
want to know, are they one of those asymptomatic carriers? And so it's a good idea to be tested, number one, periodically if you want to make sure that, there's no virus in your community, but also if you're sick. And this is another one of those things where I wish the answer was you could just be tested once and you're good,
Yeah.
but you're not.
I like the idea of what you say there about the surveillance testing kind of approach to it. We're really just trying to get a broad picture of where this might be and contain it quickly because of the nature of this and with its big incubation period and how quickly it can spread. And so it is good for us. And the hospital is encouraging. If you've had, and I'm just throwing this out there, is the hospital encouraging? If you had a test a month ago, is it wise to come back in now and have that follow-up test just to kind of keep a surveillance on
Sure.
someone in the household?
Yeah, and remember, we were advising one person per household, so we could just see what was out there.
Right.
We have been blessed that, the rate of virus activity in this area has been pretty low. But we all know that the casino is opening
Right,
up and the
right.
borders are open. So we cannot lose this vigilance that we have. We still need people to come in and let us test them to see. And remember, we talked about before, if we catch that one person or two people or four people early, we can stop this virus from
Right.
overwhelming the community.
And our next question was surveillance testing. I like how I jump ahead of things. I have that problem in general. I'm always interrupting people. And so I went ahead and jumped ahead of the surveillance testing question.
Yeah.
So just to understand, I can be retested if I feel like I have symptoms, been potentially exposed, or have traveled to a high-risk area, right?
Yep. Yeah. And so if you think that you've traveled and maybe you forgot your mask in the car or
Okay.
whatever, and somebody coughed right in your face, so let's classify that as a potential exposure.
Okay.
You're worried. When
Right.
should you be tested? Anytime you're feeling symptoms, you should be tested.
Okay.
And that's like cough,
Yeah.
shortness of breath, or if you have a fever. But if you just want to know, the standard is about 5 days after you've been exposed. That's when most people are going to start testing positive. But up to as much as 14 days later, that's the incubation period.
So if, somewhere between 5 and 14 days, if you feel like you've been exposed, that's a good time to go ahead and call and come on in and get a test, right?
Yeah, and
you don't want to come that afternoon.
Not right away. No, we're not. We're not going to pick it up.
Okay.
The virus hasn't had time to get into your body and multiply and get into the back of your nose.
And that's a good point to put out there. So if you've been exposed, give it almost a week, 5 to 14 days. Come in, get a test. That way you know for sure if you've had exposure and if you're carrying the virus.
Yep.
Good deal. So what are the risks of repeated testing?
Very little. So I've had the test. You've had the test.
Right.
It's a little bit irritating to the nose, so you may have a little bit of irritation there, but there are really no risks to have a repeat test.
So they're not going to jam this thing into your brain too many times and fumble it around. I mean, mine in particular.
No, we're professionals.
Okay.
Yeah, we don't do that.
Just want to make sure you don't damage my nasal cavity here.
Yeah.
What are the long-term plans of COVID testing at CIHA?
So our plan is to just maintain that surveillance that we already talked about. We just want to be vigilant, see if the virus is coming into this community. So we're going to stay at a surveillance level, and then at any time that we pick up some disease activity, we're going to focus in and we're going to do more testing there.
Gotcha.
We're going to continue to do tests on our staff, and in particular, we're going to be very protective of the nursing home and Kanawoti, because these are, we call them congregate living,
Right.
where there's a lot of people living close together. So you've all seen what happens when this virus gets into a nursing home.
Right.
And so we're just going to keep watching for it, and if we see it, we're going to hone in. We're going to try to contain it.
Okay. What would you say to frontline employees? Is that someone that should be coming in regularly and getting tested? folks that are working in, and I mean like folks that are working at fast food establishments or retail establishments where they're having direct contact with folks regularly, different folks coming in and out.
Yeah, and last time I think we issued that challenge for people that work in the grocery stores, people who are making a lot of deliveries. So if you are in an occupation where you're coming into contact with people frequently,
right,
you should be wearing a mask. Yeah, but also it's a good idea for you to be tested.
Right. I think folks should keep paying attention to what we're doing with our testing. I know we've talked about down the road the potential of incentivizing some of this, where we might offer some kind of a prize or a random reward for folks that come out and get these tests, for their household, I guess, whether it be some kind of a coupon or a gift certificate or something. But that's down the road. So I want to start the buzz now in case that does roll out, that there may be the potential that we start to incentivize some of this testing. But we want folks now to come on out as ahead of this as we can.
Yeah. The number of people showing up for testing who are asymptomatic has gone down.
Okay.
So we want to encourage people to come in. We want representation from every community.
Okay.
That is still kind of important, especially once the casino opens and the boundaries
Absolutely.
open up.
So in the next week, we should get a lot more participation from our communities because they'll have been open for a week and a half.
Yeah,
now.
if they're watching this, yeah.
Absolutely. If they're at home watching us or watching the replay, hopefully. Okay. So what are the long-term plans of COVID testing at CIHA?
Didn't we just answer that one?
Yeah, sometimes I like to just reiterate the question twice.
Okay, well, let me answer that again.
Let's run back.
We're going to keep doing it.
This is a good one. President Trump, and I'm really curious about this. He just announced that he's begun taking hydroxychloroquine. What is that, and should I be taking this as well as a preventative measure?
Okay, so no, you shouldn't. That's the short answer.
Okay.
Hydroxychloroquine is a medication that's, when it's prescribed by a doctor for certain conditions, is pretty safe.
Okay.
But there's no reason to take it to try to prevent catching the coronavirus. And in fact, it has some very serious side effects.
Okay.
If I was going to prescribe it to you and you had lupus, rheumatoid arthritis, malaria, which not a lot of that around here, but if I was going to prescribe it to you, I would do some blood tests and an EKG to make sure that this medicine is not going to hurt you.
Okay. Gotcha.
If you just went and got some somehow and took it yourself, then you risk a rhythm problem that could kill you, and somewhere between 1% and 10% of the people are going to have eye side effects from it, some of which, depending on how much you're taking and how long you're taking it, could be permanent.
Okay.
So it's a real bad idea, and I shared before the cameras went on that there was actually a report of a family who looked at this substance to clean out their fish pond that had chloroquine in it. They took it. They got very sick.
Okay.
So this is just not a good idea. Now, if you're under a doctor's supervision and there's a good reason to take it, I want to emphasize those people who have these conditions. It is safe to take this medicine, but you got to have a doctor that's monitoring your condition.
Gotcha.
Please do not take this. I mean, we don't give people antibiotics year-round just in case they're going to catch strep. I mean, that doesn't work. And then what happens is the infectious bacteria can become resistant. So it actually makes things a lot worse.
Okay.
And it can hurt you. That's the main thing.
Just make sure that if you have any questions out there, that you call our COVID hotline and ask those questions, whether it be about the hydroxychloroquine, how to wear a mask, what can my mask be made out of. I did have this interesting guy the other day I met who said, "Hey, do you want to see the how well your mask works?" And I was like, "Not really. I'm kind of scared now." And he's like, "No, check this out. Blow this out." And he lit his cigarette lighter. He's like, "Try to blow that out." And I was like, I tried to blow it out, couldn't blow it out. He was like, "Yep, your mask is good." I was like, "Wow." He's like, "So there are some masks out there that are a little too thin, I guess, of the fabric. And if you can blow out a cigarette lighter or a match or something, then it may be too thin, and you might want to consider getting another mask with at least a double layer or more protection." So keep that in mind if you're out in the public and you're wearing a mask or looking at picking one up. If you can blow out your cigarette lighter, which I don't even actually have one. I'm glad the guy had one.
Yeah.
Try that and it'll test your mask. So we've got this session will be up on Channel 28 live. We'll edit it up and we'll rerun it through the week. But I did want to highlight the testing that we're going to have today at 1 o'clock at Drama Hill. So we're going to test today 1 o'clock to 3 p.m. at Drama Hill. please, if you haven't been out, someone from your home hasn't been out, come up and get tested. Help us with this surveillance, visual, so that the hospital and public health can see where this is at or where it's not at, and we can clear the areas out. And it's good peace of mind as well. And I also want to remind everybody that this is, as we mentioned earlier, this is a new virus. We have to take a personal responsibility at this point as things are opening back up. And you'll hear this a lot, personal responsibility. It's a good thing. It's not a bad thing. We've got to protect ourselves and our families, and especially our elders and our speakers. Wear your masks, wash your hands, practice social distancing. It's not really that difficult. It can mean the difference, though. You don't want to be that person that gets grandma sick and being careless. Try to just wash your hands, wear your mask when you're around some of our elders and folks that have other issues with this, to protect them.
Yep.
Well, Dr. Bunio, tragically sad that you're a Browns fan, and I'm also sad that our day has come to an end.
Yeah.
But it's been real fun, and I guess we'll get together again if we have some more questions pop up on Facebook or from the public. But that's been a good one.
Yeah. Thank you, Chris.
Thank you. We'll see you again very soon. Dada Daga Hunyu.